The 1918 influenza epidemic killed millions around the globe, around 9,000 in New Zealand alone, and Dunedin saw over 270 people die in just a few weeks. Medical professionals say it's not a question of if it could happen again, but a matter of when. There have been several smaller-scale flu pandemics since 1918, but medical technology has also advanced markedly since then. Nowadays we have a global surveillance system, and the New Zealand Health Ministry puts out a weekly report on the number of hospital admissions and flu diagnoses around the country. This information, along with the clinical analysis of samples, goes into making the annual flu vaccine. Former public health lecturer Warwick Brunton says back in 1918, flu vaccines were still in their infancy.
The vaccines were really at a very early stage of development in 1918 and certainly wouldn't have really made a great deal of difference given the availability of them.
However, it's a constant challenge for health providers to stay one step ahead of the regularly mutating virus.
There have been flu epidemics, not on the scale of the 1918 one. Since then, it's a rapidly changing bug, as it were, and the bacteriologists and virologists have to just try and keep one step ahead of it in trying to provide the vaccines which were now available.
Dunedin's Toitu Museum has one of two remaining examples of a spraying device that would spray zinc sulfate on patients. This treatment was supposed to help build up people's immunity back in 1918, but Dr. Brunton is sceptical.
I don't think so, really. The medical opinion was clearly very divided over the value of that, although zinc sulfate, I understand, is the basis of Ventolin.
Despite medical advances, no one is 100% safe against influenza. But in addition to modern vaccines, following the same basic hygiene precautions of 100 years ago, such as regular hand washing, provides at least some additional protection against influenza. In Dunedin, for the South Today.